This segment is sponsored by FDA, Division of Non-Malignant Hematology.
Sickle cell disease is the most common inherited blood disorder in the U.S. The disease affects approximately 100,000 Americans. It primarily affects African Americans, 1 in 365, and Hispanic Americans, 1 in 16,000. About 1 in 13 Black babies is born with sickle cell trait. We remain committed to raising the profile of this disease as a public health priority and to approving new therapies that are proven to be safe and effective. Together with improved provider education, patient empowerment, and improved care delivery systems, approved drugs have the potential to impact people living with sickle cell disease. So hemoglobin is a protein in red blood cells that carries oxygen. People with sickle cell disease have an abnormal hemoglobin called hemoglobin S or sickle hemoglobin. The shape of the red blood cell changes from a flexible beanbag to a sickle form when it is deprived of oxygen. Red blood cells become rigid and shaped like crescent moons. These cells are sticky, block blood vessels, and reduce blood flow. This blockage leads to complications seen in sickle cell disease. When the cell changes to this sickle shape, oxygen cannot be delivered to various parts of the body. These misshapen cells are more likely to be damaged, and the body has trouble keeping up with how fast these cells are destroyed, causing a low number of red cells, which leads to anemia. In some countries like the US, the disease is diagnosed at birth. For those not born in the US, sickle cell can be diagnosed with a blood test that will show the sickle hemoglobin. The test can be ordered by a medical provider. After diagnosis, the person should be followed by a healthcare provider knowledgeable in sickle cell disease. There are various types of sickle cell disease. The most common is hemoglobin SS, which is the most severe subtype. Other subtypes include hemoglobin SC and hemoglobin S beta thalassemia. Sickle cell disease affects all organs of the body, from the brain to the skin. The clinical manifestations of the disease include fatigue, infection, pain crises, strokes, blindness, lung complications such as acute chest syndrome, gallstones, renal disease, priapism, and skin ulcers. All patients diagnosed with sickle cell disease need early diagnosis and regular expert medical care to prevent complications and improve their health. In the early 1970s, people with the most severe type of sickle cell disease only lived for approximately 14 years. Now, with new treatments available, people with sickle cell disease can live into their 50s and 60s.